Between that and the cold open and the
survivors of the syphilis study, many Americans survivors of the syphilis study at Tuskegee are a living link to a time not so very long ago that many Americans would prefer not to remember, but we dare not forget. It was a time when our nation failed to live up to its ideals, when our nation broke the trust with our people that is the very foundation of our democracy. It is not only in remembering that shameful past that we can make amends and repair our nation, but it is in remembering that past that we can build a better present and a better future. And without remembering it, we cannot make amends and we cannot go forward. So today, America does remember the hundreds of men used in research without their knowledge and consent. We remember them and their family members, men who were poor and African American, without resources and with few alternatives. They believed they had found hope when they were offered free medical care by the United States Public Health Service. They were betrayed. Medical people are supposed to help when we need care, but even once a cure was discovered, they were denied help and they were lied to by their government. Our government is supposed to protect the rights of its citizens. Their rights were trampled upon. 40 years, hundreds of men betrayed, along with their wives and children, along with a community in Macon County, Alabama, the city of Tuskegee, the fine university there, and the larger African American community. The United States government did something that was wrong, deeply, profoundly, morally wrong. It was an outrage to our commitment to integrity and equality for all our citizens. To the survivors, to the wives and family members, the children and the grandchildren, I say what you know. No power on earth can give you back the lives lost, the pain suffered, the years of internal torment and anguish. What was done cannot be undone, but we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry. The American people are sorry for the loss, for the years of hurt. You did nothing wrong, but you were grievously wronged. I apologize, and I am sorry that this apology has been so long in coming. To Macon County, to Tuskegee, to the doctors who have been wrongly associated with the events there, you have our apology as well. To our African American citizens, I am sorry that your federal government orchestrated a study so clearly racist. That can never be allowed to happen again. It is against everything our country stands for, and what we must stand against is what it was. So let us resolve to hold forever in our hearts and minds the memory of a time not long ago in Macon County, Alabama, so that we can always see how adrift we can become when the rights of any citizens are neglected, ignored, and betrayed. And let us resolve here and now to move forward together. The legacy of the study at Tuskegee has reached far and deep.
Welcome to the Tin Rabbit Podcast, where we diagnose the truth and prescribe a course of skepticism. Tonight, we're performing a biopsy on the medical industry. Medical malpractice, cover-ups, and conspiracies? It's a deadly disease that's infecting our trust. As we dissect the shocking cases of medical malpractice, you'll be shocked at how often the cure is worse than the disease. We'll expose the toxic truth behind the white coats and sterile walls, show how the pursuit of profit can be a deadly prescription, and we'll expose the festering wounds of insurance company greed. Medical experimentation has left a dark spot on the medical profession's reputation, which needs to be disinfected. We'll explore the disturbing legacy of experiments gone wrong. Also, the alarming rate of the medical malpractice is a pandemic that's spreading fast, claiming hundreds of thousands of lives each year, and it's the third leading cause of death. Insurance companies are often the definition of adding insult to injury, denying coverage and dropping patients when they need it most. We'll examine the immoral tactics used to maximize profits. Join us as we operate on the root causes of the medical industry's malignancy. We'll work to find a cure for the system's sickness and prescribe a healthy dose of transparency and accountability. So allow me to welcome all you fluffles and make a toast to your health.
And I signed it into law. It's been nearly a year since the Supreme Court upheld the law under the Constitution. And by the way, 6 months ago, the American people went to the polls and decided to keep going in this direction. So the law is here to stay. And those of us who believe that every American deserves access to quality, affordable health care have an obligation to now make sure that full implementation moves forward the way it needs to. Now, basically, there are two main things that the American people need to know about this law and what it means. First, if you're one of the nearly 85% of Americans who already have health insurance, whether it's through your employer or Medicare or Medicaid, you don't have to do a thing. This law already provides you with a wide array of new benefits, tough new consumer protections, stronger cost control measures than existed before the law passed. And those things are already in place. You're benefiting from, you just may not know it.
Yeah, benefiting.
Making sure that insurers can't take advantage of you. Making sure that your child can stay on your health insurance until they're 27 years old.
First he says 27, later he'll say
Those
26.
provisions are already in place, providing help
Yeah, I
and
think it is.
assistance to people all across the country.
I don't consider that a
Now,
child.
second, if you're one of the tens of millions who don't have health insurance,
Masters.
beginning this fall,
PhD.
you'll finally be able to compare and buy quality, affordable, private plans that work for you.
We still have 25 million people uninsured
That's where-
to this day.
Right?
Cookie, can I please do your cough?
Go for it.
So that's what you
Bullshit.
If you've already got health insurance, this
I
is just
patented
enhanced
it.
it.
It's mine
If
now. Bullshit.
Oh,
Yeah, right. Let's get rid of it.
I didn't listen to that whole thing. I just threw it in there.
Oh,
Don't
yeah.
worry, half of it is fucking bullshit anyways.
But no,
I know.
half. Well, yeah, tell me the half that wasn't bullshit.
The other half.
I experienced quite a
Hi,
bit of that.
Fluffles. Welcome to another episode of the Tin Rabbit Podcast. Ladies, gentlemen, children of all ages.
No kids.
Oh, of all ages. Well, yeah. Children of adult ages. How about that? Is that better?
Yes.
Yes, this is not a kid's show. I'm sorry. We're gathered here this evening to discuss the medical industry, malpractice, the insidious insurance industry, and the testing and like Bill Clinton was talking about at Tuskegee and other the horrors that they have done to the Native American population. And I want to be honest, this show was a real bummer for me. I did way more research than I should have. I was living in a bit of ignorance. I knew it was bad. It's just when you start looking at this stuff, you find out how bad it really is. And yeah, so it was a bit of a bummer. But
Well,
Go
think
ahead.
about, dude, think about
Disclaim.
the people that doesn't know this.
Right?
right, yeah, I know. This is my public service. This is my penance. This is no good deed goes unpunished kind of thing. But next week we're going to be doing Political Science Theater 3001. We're going to try and switch things up, and we're just going to talk crap about like that. We got a little sneak peek there.
You
Only
know,
we'll be doing
flip the script, talk some shit.
right, yeah. So we're going to actually have a few laughs next week because this one's going to be a downer.
Aw.
Well, not
I've got some positives
Well,
coming up.
right on.
Positive things that came out of negative situations. That's the best you can do.
Right.
Mhm.
So whatever time it is right now, next week, this same time, we'll be here doing that Political Science Theater 3001. I think that'll be a good laugh. What do we got? Oh, I forgot the disclaimer.
It's all right. Jacqueline, mom, let us know.
Thank you. Oh, yeah, right. Yeah, we should do
Well,
definitely.
Cookie's mom.
Well, and I did put the printed disclaimer about this not being a kid's show, so at least we got that one out of the way. But this program is a fictional portrayal of a couple of knuckleheads who are pretending to be conspiracy experts. This podcast in no way should be considered informational and is for entertainment purposes only. Unless you learn
Yay.
something, then it should only be educational and not entertainment.
Right. You can still learn stuff with humor.
Well, yeah, but you need satire is what you need. Satire is the magic word to get you past a lot of censorship, I guess. I don't know. We're not monetized, so Better Half is always worried about copyright strikes. But most of the time, it's just to keep you from monetizing. And jokes on them, we're not monetized. So
Well, the thing is, they could come after us later and be like, "Oh, here's some copyright strikes."
Hmm
well,
They do. They can come a couple years after even.
When we get
For
to
sure.
1 million, because it's gonna happen, man.
Like Stella
We're that
Artois
awesome.
right. But
will come.
I've got a kicker at the end of the show. It's a fun music. I was trying to find something that was themed, and
I'm going to be bad tonight.
and I didn't want to do Bon Jovi Bad Medicine, you know. And so,
What?
Yeah, right.
I love Bon Jovi.
Yeah,
Best,
right.
man.
Shonda took it. She did it last week.
Aw.
There's only
Because
one.
that's the
No, I
biggest
swear
form
to
of
God, on the
flattery.
internet, there's only one decent cover of Bon Jovi, So I'm
Hey,
gonna
first
do
come, first
something
serve,
that's
man.
a little off. I'm going to do something that's a little off topic, but his name is Bill McClintock, and it's really funny. He's awesome, so you should check him out. But we'll save that for the end.
Mashups.
Yes, so
Yes,
funny.
they are fun.
Oh, so funny. And
We're
he's got a ton of them. I spent one whole day going through them trying to find one that was medical. Unfortunately,
wanna-
I did the Bon Jovi.
Talk about malpractice first, or Cookie, you want to talk about insurance?
I don't care. How do you want to handle this, man? Let's do this.
I think that the reason that we have insurance is partially because of the fucking malpractice.
Wow.
And I'll interject my mistreatment of people in between your guys' conversation, if you don't mind.
Wow, 15:30. You just got under the wire or over the wire to start saying the word fuck. Congratulations.
Oh, you're not allowed to cuss
Well,
before
in
7?
the first 15 minutes, I think, then that'll.
We said it's not children.
Well, I understand. But
Did I cuss?
Did you? Did you?
Is it really
See-
a bad word? No.
well,
It's a verb. It's
how
an
can it be bad?
adjective. It's a
Right,
sign of
right,
intelligence.
right. Okay, sure. Pain relief. They actually did studies with putting your hand in ice water, and one person
Right.
had to be completely quiet, and you could last for 5 minutes. And then you put your hand in the water, and you get to swear you could last for like 10 minutes. Just
Whoops.
natural.
I
What are
didn't
you
want
doing?
it. I just,
I'm not
sorry.
gonna let you touch a mouse anymore. Swear to God.
Yeah.
So you want to do malpractice first, man?
I think,
You know what? Enjoy your beers. I'll start with
Yes.
insurance.
oh, okay, now I'm going to mess up my slides. Hold on.
Oh,
I was just about ready to present the history. Oh, you're going to start with insurance. Yes, sir. I have a little info. Where'd it go? Oh, there it is. The history. While you talk about it, people can read that if you want. A little bit
Yeah.
about insurance effery.
No, it is insurance effery. Effery? I'm not making fun of Asians. This is F apostrophe R-E-Y,
Yeah, like the fluffles.
Yeah. So
Sorry.
the main reason I want to talk about insurance is because we've all been scammed into it. Like looking at the slide you have here, across time, we were not always forced to have insurance. It was once like a real big privilege and only certain people could afford it. And then they started mandating it, and then they started privatizing it. And once it started getting privatized, then they started focusing more on making profit rather than providing proper insurance. And then like as time went by, prices and profits went up and up and up, even though insurance companies were complaining that they were losing money to paying out insurance claims. So you get to 2010 when the Affordable Care Act showed up, that literally solidified the entire insurance fuckery. It's gone.
I was going to be the title of the show, but they wouldn't let me name it medical fuckery. It's appropriate sometimes. I know I beep us out, but
No, it's 100% appropriate.
it's
You just
so
can't put it in a
confusing.
YouTube title or nobody will ever see it.
okay.
I mean, if you
Fine.
want it to be a secret show,
Okay.
then yeah, we could have probably used that as a
Well,
title.
yeah.
So the whole thing about the Affordable Care Act is it mandated everyone to get insurance. I think everyone knows that by now. If you don't know that, people out there, now in America, in America now you have to have insurance. You have to, otherwise they penalize you on your income tax. So if you don't have insurance covering you for the entire year, they penalize you on your taxes, and then they take money away from you. So if you're already poor and you can't afford insurance, then you're going to be dinged for not paying for that insurance. And they say they make it cheap and affordable for you. It's true. If you are very, very poor and you go on there and you don't, like, let's say you're in that
And you
weird,
Medicaid.
yeah,
If
you're
you're
in
that
that
poor.
weird, yeah.
Mhm.
But if you're in the weird area where you're poor enough to not afford like good insurance, but you're not poor enough to like qualify for Medicaid.
Or if I may, Cookie. So your options are Medicaid, or you have an employer that you have insurance offered to you. And if you don't have insurance offered to you, you have to get Obama or whatever, the free market insurance.
Right.
You have to get Romney Care. Yeah,
Well,
Heritage Care.
That's
But,
what I
yeah.
mean. Is like they give you the bare minimum, but they force you to pay it. And my whole thing about what I wanted to talk
Yes, sir.
about is how our system is now set up, thanks to the Affordable Care Act, how this is all now set up to make sure that insurance companies maximize their profits. And I have no intention of providing, in fact, they make more profits if they can deny you claims. So I wanted to quickly share a little clip of a video for everyone on this one, for that this guy's a doctor, right? And since he's a doctor, he likes to make these little skits about the medical industry. So,
Which applies to, oh, you're going to play the guy. We didn't copyright check those, just so you know. I wouldn't do it. Or we're going to have to edit it.
He's a TikTok.
You had
He's
all
a
his
TikToker.
points.
Yeah.
Okay.
So
I
yeah,
already-
I'm gonna play it. What's the worst
Sure.
thing they can do? Take it down? Okay.
We can clip it out later if we have to.
Yep. So
If we go jump right to something else and you're watching this in a replay, that's because we had to clip this part out.
for real. All right.
Hey man, how's it going? Had to do prior authorizations all afternoon. What are prior authorizations? Well, if a patient needs an expensive test or treatment, we have to ask the insurance company if they'll pay for it before we do it. Why? You're the patient's doctor. Well, they want to make sure I'm ordering something the patient actually needs. Oh, so you're talking to another doctor that has your level of expertise. No, usually the person didn't go to med school. So they can say the patient can't get the treatment that you, their doctor, recommend? Yeah. So these insurance companies are practicing medicine without a medical license. Well, no, I'm making the medical decisions. Are you though? Well, yeah. If insurance denies it, then the patient won't get the treatment, which means they won't get better. Well, maybe. Or the patient will get the treatment anyway, but be financially devastated by it. Yeah. Which could lead to even more mental and physical health problems that don't get treated. Yeah. Either way, the insurance company is making medical decisions that directly impact the health of a patient. Yeah. Which is also known as practicing medicine.
So that's what I wanted to talk about, man, is that, you know, the insurance companies are set up so that they make sure that you are forced to pay. The Affordable Care Act made sure that every American is mandated to have insurance and to pay for insurance. So that guarantees the insurance companies money. Now, what their trade-off is, and one of the ways that they sold it to us, was that they told us that, in the Affordable Care Act, we'll be giving you the allowance and ability to access cheap insurance. Everyone will be covered. The way, the quote that I got, this is from the...
Did you go through a broker? Did you ever go on the Affordable Care Act? Like
Yes.
You went through the
I
whole
went through that
process.
spiel once, yeah, just to look at...
I'm sorry, Cookie. Did you use a broker or did you do it yourself? You know what I'm saying?
Yeah, when I did that years ago, I just did it to see how the Affordable Care Act system worked, just to get a quote. I already had insurance from the job that I had, but I just used it just to do it. So I don't know, whoever was on the Affordable Care Act, the website. The quote that I like to quote for this is the ACA also established guaranteed issue, meaning that insurers must issue policies to anyone and can no longer turn away people based on health status. Now, the reason they did that is so they can they took away your ability to sue. And the way they did that is, okay, back in the time before the ACA, you were allowed to sue for discrimination. Like, hey, you denied me coverage because I have a pre-existing condition, or you denied me coverage because I had this and that. Now they can provide you that coverage, but they can deny you payment.
Right.
And you're still paying your premiums, you're still paying your out-of-pocket, you're still paying everything, but they're still making profit, and they're still denying you the coverage.
Yeah, we won't deny you the insurance. We'll just deny you the payouts that you would need when you get sick.
Exactly. So that's one thing of the one. Yeah.
Like,
what are you confused
Give me an example, because I know that we take care of my mom at home. We don't have much money, and we don't have a company to offer us insurance. Sure. And the government pays us. My mom is legally blind and disabled, and so she gets paid through Medicaid to have it's in the state of Colorado, a medical program that pays us to take care of mom. And we can hire other people. Like right now, in order to do the show, we've got a caregiver downstairs helping us, so we can just focus on this. And so we get personal insurance. And my experience was that we were covered for like $19 a month. And it was great the first couple years.
Yeah, Right.
And then I had a major procedure done, not this recent one while we've been doing it. And it placed us in such a large medical debt. Plus they upped our premiums. Plus they denied me certain basic like annual stuff like mammograms. And they messed up. So it started with like just not the Affordable Care Act, but also the people, the billing people. It goes all the way from like the government down to the administrative person.
Yeah.
And we just got screwed. And we're one more major incident in our lives between we've broken bones, we've done, just different things, reasons. And we're a car accident away from bankruptcy and having to pay all these payments. Sure, they don't charge you insurance, or not insurance, interest, to make payments. Oh, what can you afford to pay your out of pocket? Yeah, it's bullshit. And it just keeps going up and up and up the sicker you get.
Yeah.
And the older you get.
I forget the name of that premium, but it's a reason that they increase your premiums and your co-pays is because you're now high. God, I wish I could remember the word. Yes, well, not high risk. They have a certain word for it, but high risk is a good one. To say.
It was under the malpractice.
Yeah, you're a very expensive patient.
Cookie.
Yeah.
But they can't deny me based on my previous history. But I'll tell you that a lot of stuff changed. Yeah. And I kept the same insurance, and it changed.
Well, see, that was half of my point earlier. Is that they took your ability away. They took your ability away. They took away your ability to fucking sue them, because back in that time, if let's say for your situation, Medicaid isn't exactly the same as getting Obamacare on the ACA. Like it's different. Oh, Medicaid is its own monster where it's got its own corruption and own money laundering. And that's a totally different video on its own.
And so is Medicare.
Yeah, Medicare too.
Top down.
Social Security, again, that's a whole other video that we could talk about. But the main point I'm talking about here is that in this insurance situation is like you're forced to pay for a certain amount regardless. So that is all government, not government profits, but insurance profits. So all that money that they're making hand over fist, and they tell you, oh, we got to deny you because of costs. It's just so they can keep their profits high. And it's really messed up because that's not the system that we originally had, even though the original system that we originally had was for rich people that could only afford it. But it had a certain level of quality that we don't have in America here anymore. And we haven't had since, I would argue in the early 90s, late 80s, early 90s.
Right. When the insurance was for the rich people, it wasn't designed to screw them because they would cater to the rich people. Once they had to let everybody in, then they started dividing into what quality of care actually meant.
I mean,
Jacqueline had I'm sorry, Cookie. May we address her question really quick? She said, is the Affordable Care Act available to anyone, no matter what their income?
The answer to that is
yes. No, it's not affordable to anyone. Well, yes, but only if they don't have insurance offered to them through their employer.
Yep.
So you have to be rich enough to not be poor, which is, I think, $13,000 a year to be on the poverty line. That was 10 years ago. I don't know what it is now, but which is crazy for a family of two to live off $13,000. Could you imagine? I should have researched the poverty line.
Can't even live off that.
Right. Sorry, Cookie. I'm sorry. Go ahead.
No. So to backtrack on that one too, that's besides the window. You get a certain window that you can enroll. If you're not in your enrollment window, you can't have insurance for that rest of the year. You have to have some
wait till
major
next
change.
January.
Yeah. No.
Or is it every other?
You're right. You're stuck. Once you get the insurance, you're stuck unless you get different insurance offered to you.
Yeah, something has to change. There has to be a new. You can't just decide. It has
you have to change.
Get a new job.
I forget the rules. Yeah,
I know.
Something has to change. The rules.
Yes, something has to change, and you can then change
but
your
if you
insurance.
miss that window, the only time you can ever just like enroll in the middle of the year and you're not getting a new job or you're not employed is if you're so broke that they have to give you some kind of insurance. And usually you go through the state or the government agency. Maybe they give you
sliding scale. Like we got like a huge credit from the government. You know, like I said, it was $19 a month. Now it's like 300. You know, it's crazy.
Ugh, yeah.
It's nuts.
Yeah, they punished us.
Because
they
of
penalized us for taking care
Not
of
our income, which didn't change,
your.
which is shit. Oh, for caregivers don't get paid much. So white bass.
Yeah.
All right, I'm sorry. Okay, let's talk about United. What about? I mean, we talked about Obamacare and all that, and the fuckery behind that. But are you ready to move on to private insurance and some of the mastery of their wrongdoings, Cookie?
Oh man, don't even. All right, so for United Health Group, dude, check out United Health Group. All right,
I know. I'm trying to find.
since
Oh, go ahead.
2010, United Health Group's revenues have increased more than threefold, man. In 2023, United Health Group reported total revenues of around, I think it was 359 billion. The 11th Health, formerly known as Anthem, they are part of that, and health revenues of theirs increased year to year over the past decade, dude. They're making money hand over fist. They made 171 billion, and it's, dude, oh man, the major beautiful con that Barry Obama did to America to get us all on the ACA has guaranteed their profits hand over fist year after year after year, guaranteed.
I
Yeah, they're
agree,
the ones
Cookie.
that wrote it. There's, of course, they're going to have a backdoor.
But I also feel like I was forced in a situation where if I didn't get us jobs or we didn't have jobs that were insured, we were fucked as well.
Yeah.
Yeah, I was going to just
So,
try and get a part-time job.
Even though I'm angry that I went like $40,000 into debt with Obamacare because of my things I couldn't control, I'm still grateful. I hate to say it, I am. Imagine how much debt we would be in the hospitals, the fuckery behind the hospitals, overcharging the insurance companies.
I got my ass up every morning
For sure.
at 3 a.m. to go into that effing Kroger's to make diabetes
They had good
donuts.
union jobs.
Yeah, that's the only reason I did it is because for the insurance.
Right.
You think I would? I wasn't getting up
They
at 3 o'clock in the morning. Wasn't getting up at 3 o'clock in the morning to make donuts because I love donuts.
I love donuts. Can't you tell?
3 effing a.m. in the morning.
Yeah, that was nuts. But that's what bakers do. If you love baking.
Yeah.
I don't know. I got up at 3 a.m. and listened to police radios.
I got up at 3 a.m. in the mornings because I love insurance that much.
I mean, I didn't ambulance chase, but I used to listen to police radios at 3 a.m. for fires, working for a fire insurance company. And, just insurance sometimes isn't as
So
evil
you're a
as
fire
we...
truck chasing?
Yeah. Nobody could die, though. If somebody died, I wouldn't send someone there.
Oof.
That was fucked up.
All right. Anyways, so
there's a line, Cookie.
I'm leaving it at that line. I'm not crossing it. Habitual line crosser. I am not.
Oh, okay.
So tell us about medical malpractice there, Mr. Mastermind Hour.
Oh God.
Attention.
Sorry.
You got to say that.
There you go. So, medical malpractice is actually, we're starting to get some nuclear judgments. For a long time, I think the average medical malpractice payout was $330K. And now we are getting multi-million-dollar settlements. Now, just to preface this, according to some studies, medical malpractice is the third leading cause of death in the United States. Now, you wouldn't know that by is it CDC? Who is it that tracks that crap? CDC?
Medical malpractice?
Yeah.
That was tracked.
They don't. No, they don't.
No, they don't. Because they don't put it on the death certificate.
The coding.
Who does the coding? CDC.
Yeah, so
the letter
CDC,
was to the CDC.
According to the CDC, medical malpractice is not a cause of death. So if you have a doctor reach into your chest and pull your heart out and start chewing on it, then you died of cardiac arrest. Well, that's basically...
What a horrible example of all the ones you could come... I need all these pretty examples of like...
No.
And they just came up with...
Nathan Explosion would approve, man.
That movie has that
fuck.
where they're ripping the... Sorry, Cookie. Go ahead.
What'd you say, Cookie?
I was like, dude, Nathan Explosion would be mad respect of you, man. That was metal.
Right.
That's a heart attack.
Well, and I guess according to the CDC, every death could be asphyxia because the last thing the reason you die is you stop getting oxygen to your brain. So technically, every death is asphyxia.
No, well,
So
okay.
what?
Let's move on
If
beyond
they're gonna clean up their coding for death certificates, they could just boil it down to one category.
Well, did you? I have part of a letter here.
Statistics are like 1 in 4 people will have a medical malpractice, not fatal, but 1 out of 4 people will have some bad medicine. And
I'm not going to make people stare at this, but when you were
geez, that's so
talking
tiny.
about the death certificates listing medical malpractice and why it was so hard to prove that it's the third leading cause and why it's so controversial is because the data, it was John Hopkins. Oh, nobody's going to be able to read this crap. I stretched it out to look cool, but yeah, it's just is what it is. Anyway, so it was a letter written by students asking the CDC in 2016 to please include medical malpractice because what drives funding for research in universities and with the government and grants and all that is leading causes of death, right? So there's like cardiovascular and then what's the second one? I don't know. But
they had COVID up there for a while. It's number 3. Yeah.
Okay, so I don't remember what I was talking about.
I'm sorry.
That's all right.
My bad. So let me get back to medical malpractice.
Right. No, it was CDC, and why they don't list medical malpractice as the third leading cause? It was a letter written to John Hopkins from John Hopkins University students to the CDC to please include that because it drives funding. And if you can drive funding, and this leads into your second point, is if you could drive funding for research and all that kind of stuff of why is malpractice happening? Why? Why is it the third leading cause, Mastermind?
Because they have
Thank
these
you.
interns that they have on 24-hour shifts.
That's nuts.
Yeah, no, you were.
They changed laws.
Yeah, no, well, they did, and then they changed it back.
Did they?
In 2000, what was it? I'm going to have to look up the numbers. I'm just
Right here.
Oh, look at that.
Medical staff are overworked.
2011. So in 2011, the graduate medical, the accredited,
Don't worry.
I want to get the name.
Okay.
Let me get the name.
All right.
Accreditation Council for Graduate Medical Education. They limited first-year residents to 16 hours instead of the regular 24. And as a result, adverse events dropped by 1/3, while medical errors resulting in death declined by 2/3. So they found out that actually letting these first-year doctors sleep reduced death by 2/3. And what did they do? In 2017, they overturned it and put them back to 24 hours a day because, I don't know, more deaths are good, I guess. I can't understand why they would change that back, but I guess they...
Because we have a shortage of doctors?
Oh, so we should run them all into the ground. What good is a doctor that's going to kill you?
Okay,
Well-
we want... Oh, go ahead, Cookie, please.
Dude, let me throw this. This is my own messed up logic and theory here. But what if they purposely drive up these malpractice issues? They purposely do it so that they can put out a public outcry that, because of malpractice, that's the reason we have to raise insurance rates and all of that stuff. So when they sit there and say, hey, malpractice, all these malpractice lawsuits is why you're paying $2,000 for a fucking procedure, where in somewhere like Canada, it's only $100 or whatever it is. You know what I mean?
Show the video. Show Cookie the video.
I am.
Okay, show the people the video.
Show me the part where I can talk about.
That's
there
what
it
he's
is.
just...
I know. I wanted
So Cookie...
Wait, you actually had that?
Yes, malpractice insurance hasn't gone up in like 20 years, baby.
Hold on.
Oh,
Yeah.
shit.
Is that frisk or is
So you can't use that as a
It's this guy right
medical
here.
fuckery.
No,
Wait.
not insurance. Not insurance. It's the
No,
reason
cost
you
to
have to,
us,
Yeah.
right? Yeah,
Yeah.
but their insurance hasn't gone up to cover malpractice insurance. They're insured to the tills.
Oh,
For
I see what you're
malpractice.
saying here.
Yeah.
Ah.
They pay
No,
out. The insurance companies do.
Yeah. Give me.
So that correlates.
Wait till you hear
Oh,
this.
I
It's
see.
from a
Here, here,
representative
here.
in 2021.
Yeah, this
It's
is
not
why.
good.
The only thing worse than a doctor is
Is
a
a poor
politician
doctor.
doctor. Oh, no. That's
Oh,
good.
not according to Shaw, it's a poor
Oh,
doctor,
here we
but
go.
yeah,
How do I play
politician
this?
doctor is pretty bad.
Can they see this? Let's try this.
And I yield 5 minutes to the gentleman from Kansas, Dr. Marshall.
Dr.
Gentleman is
Marshall.
recognized.
Thank you to the gentleman for yielding. I'm not an attorney either, Mr. Speaker. I'm a physician. As a matter of fact, I'm an obstetrician.
Ooh,
And I
best.
think of all the people, all the
Yeah.
professions impacted by malpractice issues, perhaps, Mr. Speaker, obstetricians have been the most impacted.
Right. They operate
I
on
remember
women.
going back as a medical student and trying to figure out what type of doctor do I want to become. And my wife and I were blessed somewhere in there to have our first child. And I remember when that little girl was given to me and heard her crying, it was maybe the greatest single moment of my life. And as a young medical student, I was very impressed and said, that's what I want to do. I want to bring babies into the world and had that moment when I get to give a baby to a mom and she looks at that baby and it's just a very special moment, just the most agape love I've ever seen.
Agape.
A mom, just a perfect heart towards that little baby. And I wanted to do that. So I started telling my professors, I want to be an obstetrician. And every professor I met said, don't do it. Don't do it. You're going to get sued. Malpractice prices are screaming. You're not going to like that job anymore. No one wants to go into obstetrics. Well, guess what? My professors were right. I did it anyway. The average obstetrician gets sued between 3 and 4 times in their career. Malpractice
if they're
remains the
good ones,
biggest
not
deterrent
sucky ones.
of physicians choosing to go into obstetrics. The average obstetrician has to spend 2 to 3
He's an
months every
obstetrician.
year just to
Calls it
pay for their
He's
malpractice
nervous.
insurance. Now, I'm very blessed.
Very
Over
blessed.
20 years ago, Kansas undertook similar tort reform like this.
Uh-huh.
And our malpractice costs have
It's capped.
stabilized. My malpractice insurance was pretty much the same 20 years after we enacted the legislation to
Mine
curb
didn't.
some of these costs. And I think it would be true for me to say that my friends that are doing obstetrics in New York, in other states without malpractice tort reform, their premiums are often 3
was
times
angry.
higher than ours is in Kansas. So we've seen work like this work very, very well in Kansas. And the good news is that this legislation will not impact any of that work as well. So I very much am in favor of this healthcare bill, of this malpractice tort reform, and healthcare. I
Uh-huh.
predict that this
Tort
will help
reform.
lower premium costs some 3 to 4% when enacted. Malpractice is a huge cost of the current cost of healthcare, and this is a first step of many steps that Republicans are encouraging or want to implement to start lowering those costs of premiums. The Small Business Association members were here in DC not but 2 months ago, and they walked out of that meeting, and I was expecting them to come back and tell me their concerns were mostly regulatory concerns, but their number one concern was the cost of healthcare, the cost of healthcare premiums, and this is a small step. If we can lower their healthcare costs 3 to 4%, this is a great, great opportunity for us to help them out. Mr. Speaker, I rise to support this bill. I encourage people on both sides of this aisle to support the bill. There should be a bipartisan support of this legislation that will help drive healthcare costs down. And I yield back the remaining portion of my time. Thank you.
Man, that guy needs more money for better ties. Did that tie come with his haircut? That was bad, man.
So this D-bag, right? I saw this. That was Marshall, right? Was that Marshall? So this guy, do no harm. He has his country ranch. It butts up against his farmer neighbor, and they have a gravel road that separates. It's not even like a real gravel road. And so they were having some flooding issues or something about basically some sort of water issue. And they came nose to nose on this gravel road. The guy was out there like damming up one of the little, what do they call it? The water, I don't know, like a ditch, whatever.
Dyke.
Well, hey,
They're called dykes.
hey,
It's
it's
a
a family
family
show. Family show. Knock it off. Fingers and saying the F word and dice. Jeez, who are
Jesus.
So anyway, this guy, they came nose to nose in the truck, And so they came out to have some friendly, not so friendly words, whatever. And this doctor representative gets in his truck, and I can't help it. I'm so I usually don't like to break the fourth wall, but in chat, I was hearing that we were way louder on our end than like Cookies or Kit was yesterday. So if I am good on volume, let me know. If I'm loud on volume, let me know. Now I'm going to get back to the story. I'll make better half check the chat. She's my chat checker. So he gets back in his truck, hits the guy with his pickup truck, pins him up against a telephone pole. This is Mr. Do No Harm, right? I think he took an oath for that. So what happened? He was District Judge Don Alvord sentenced Marshall to 5 days in jail, but suspended the sentence, imposing a $150 fine and ordered him to pay $75 in court costs.
I just want to point something out. Okay, that dude was talking about 80%, or that how expensive malpractice suits are. Look at that stat right there. 80% of all malpractice lawsuits end with no payout.
Yeah.
Okay.
Oh yeah. Well, unless you're in the military, because they just did that Heroes Act.
Stuff.
I'll get to that, but yeah, the military, their malpractice, they pay out 3%. 3%. Out of 560 some cases, they paid out on 20. So anyway, not bad enough that they charged him $150 fine and $75 in court costs, but that was too much. They actually had it then reduced to change it to a traffic infraction, failure to exercise due care in regards to a pedestrian, which is a $45 fine. And so basically that's the same fine as if you're pulling up to a stoplight and you park in the crosswalk.
So you paid it.
That's that $45 fine.
$300 so far?
No.
Yeah, between all the other fines.
No, but that $150 fine was reversed because he couldn't afford a $150 fine.
Oh, poor doctor.
Yeah.
It's very expensive. Medical school is very
Well, because
expensive.
he's an OBGYN, so they get sued a lot.
They do. They have better insurance. Oh,
You can't buy you Penny and hookers on fucking pennies. You need
right? Yeah.
What?
His
Ask Hunter.
So now, just as wrap up, he's now a Kansas City area defense attorney. His son, Leonard Flisk, he's a Great Bend orthopedic surgeon who in 2000 founded a surgical center with Marshall and other physicians. It shows Marshall is living in a living trust named for the elder Fisk's wife. Both had ownership stakes. Oh, geez, that was written horribly. At 9.4% at the time of 2008. So yeah, he's sitting up there and talking about how they can't afford to let these caps go on malpractice because your insurance or your care will go up. But that's the same thing they say about McDonald's raising minimum wage to $15 an hour. Then your Big Mac's going to cost $12. Well, we know that's not true.
Dude,
all they're doing is they're
audience
complaining.
wants to know: does Cookie have a big stick?
Cookie have a big stick? Oh, because he speaks softly.
Oh, dude, it's about 4 feet long if you measure from the back of my spine.
It's not being able to.
We get.
So
okay.
I'm sorry. I do have another video if you want to see that.
It's not schmooly in a towel, is it?
And
I've seen that for enough times.
Messed up too, because we could talk about bets, and I could talk. Oh, I'm sorry, Cookie. What?
Nothing. Go ahead.
Well, there is. We like to throw in a recent, in the news kind of news.
Yeah.
And
something Trump did good.
About that military,
Trump did one good thing.
See, you're gonna have to look up the names. There was a woman that was in the military.
Just tell the story.
Okay, so basically, they made it a law that you can't sue the government, military. If you're in the military, if something happens to you because your commanding officer is a complete fucking idiot.
It's the Ferris doctrine.
The Ferris. That's the one I was looking.
Yes. Right.
So yeah, you can't sue the government for being stupid. But
like if your commander gives you bad instructions and you get injured,
that would be stupid. That would be stupid.
Dude, one command that everyone should follow? Please share, like, and
I know.
subscribe. That'll help
And
us
I was
out.
going to try to get your winner,
Oh, yeah.
but then I
Okay.
just got to do no harm.
Okay, I'm gonna give everybody
I'm
a
sorry.
minute, a second. I'm only giving you 1
Oh,
second to hit the
like
like
it.
button. It doesn't take that long.
No,
So,
there's 20
that it,
people
Senator?
here. We should have 20 likes, right? We would
so
enjoy your support. Sorry.
thank you.
Yes.
So they did, that was the HEROES Act, where they said that if you get medical malpractice that wasn't in the battlefield,
Right. Like when
You
you go to
could-
the vet hospital.
right, you can
And get-
still have malpractice
You can sue them.
protection.
Before you couldn't
Yes, no, yeah. that's what
because
I'm
they were part of the
Exactly.
Department of
saying. That was
Defense.
a fair, yes.
Right.
But that was supposedly a big deal. But like we were saying,
And Trump changed
within-
it. So you can sue their asses now.
Right, but
You
since he
can sue
changed that, there
vet
have been
hospitals. Yay.
597 claims filed under that law. Only 20 have been approved. So that's 3%. So I don't know how much protections that's given. But the one that just happened a couple days ago, a woman went in for a C-section. She was having a baby.
Oh, good Lord, this story.
And,
Please. I have more
What?
examples. Go ahead.
well, that's.
This is
you
the
want-
messed up
You
one.
want the recent one.
You're right. It's new news.
Yes, this
Yes.
just happened.
Yes.
Don't leave me
And-
hanging, man. She was having a C-section, and then what
Yes.
happened?
They
infected.
took the baby out, screwed up the C-section, sent her home.
She lost 900
900. Yeah, so a human being has like 4
I don't know
liters,
enough.
and she lost 1. She lost
A quarter,
a quarter of her
Shit.
blood and her uterus. They had to go in and take out her
or
uterus
she would have died.
to save her life, and now she can't have any more kids. And we'll see if Uncle Sam gives her a bloody
Here's 50
nickel.
grand.
That's
Good
not
luck.
that's just not the whole thing. What happened was she had to sign a non-disclosure agreement. And that's
Oh,
where
the
it gets
NDAs.
really screwed up, where the government mixes with the hospitals, mixes with the insurance,
With the lawyers.
with the lawyers. So an NDA is a non-disclosure agreement. And don't ever sign one of those, ever. If anyone's ever in trouble with medical crap, don't ever sign it. I don't care if it's a public or a private hospital. Refuse. But sometimes when you're sick and you don't have a choice, you're going to agree out of court with these tort laws. Most of them are settled out of the courtroom in civil suits, not public.
Yeah, we'll pay you out. You don't have to go to court.
I'll let you
but have
explain
to
it. I'm
sign the
sorry.
NDA. No,
Yeah.
that's just
A
it.
non-disclosure agreement says that you're not going to say anything negative or about
Talk about
how
it.
much you
Can't talk
got,
about
how
it
much
at
money
all.
you got, or anything like that. And they're supposed to send like these patient advocates to you when you have like this mistreatment, and they're supposed to help you with. No, they send the hospital lawyers and call themselves patient advocates and shit. Don't fall for it.
They're definitely not looking out for
It's-
your best.
no.
interest. So, where was I?
You were talking about NDAs at one point, and the woman who got the C-section, and they made her
Oh, right.
sign
That
this NDA, and she was tripping out because it was at a school hospital, like a university hospital. Am I triggering your memory? You want to tell the rest of it, or
I know that.
and she?
Oh, was that Washington, University of Washington? I know.
Yeah, it was
Yeah, they've had a lot.
universities-
That's a mess. If you're in Washington, dude, I would go
That-
to Idaho to have any procedures done.
It's any there's like 32 examples.
Well, and
but-
that's what
so what happened was
State or DC?
state.
So what happened was the woman signed this non-disclosure agreement to get money because she couldn't have any more babies, and she got all this money. But she said she wouldn't say anything. But NBC did this huge like investigative thing. I know it's NBC, but still, they went and ordered all the public records
Right.
of university hospitals across the United States and asked for malpractice lawsuit settlements because it's public funding.
Right. She
They
can't
get
talk
public-
about it, but NBC can.
Right.
Anybody
And so
but
she's
her
like,
can talk
this
about
is
it.
weird. I'm looking at something I can't talk about, but you guys are talking about it.
I can't say any of this, but I love it.
But you have to have a whole NBC staff to get that information,
Well-
to know whether my local hospital has a screwed up doctor or not.
Well, and
Talk
now
about
there's-
doctors messing with you.
we were talking, I think, previously
'Cause we're at
about
50.
medical tourism. Now we're getting medical malpractice tourism because there's a place they're getting sued in Idaho from a company in Tennessee But, because they start doing all these combining hospitals and merging stuff, now they're opening themselves up to laws of other states, which I think is going to, people in Pennsylvania, or the state of Pennsylvania is getting lots of medical malpractice suits from New York and New Jersey. They're all jumping over the line because Pennsylvania took the cap off of their malpractice. So they got rid of that tort crap, right? Philadelphia.
Can I make a bad joke? This will make Mastermind laugh. Because our kid, we don't
I used to shake babies.
Never shake a baby.
My babies.
Sorry.
When the
And we joke
That's
around.
my first
They do love
memory of moving to this town. It was
The
back.
big billboard.
Yeah, it was like
That's right.
2002.
Yeah.
And the whole billboard was never shake a baby. And I'm like, what kind of
So
town did I move
talking
into?
about control over children and how to treat your children. When I was researching this show, I came across, actually it was when I was researching not false flags, but the one before that. And I came across an incident where a Native American, please.
No,
No.
because I still have, before I know you want to get into that, but I still have the first.
We're just at an hour and I just, it's up to you.
We're going to turn into a pumpkin? Okay.
Well,
all right.
that's right. We
This
have a
one's-
caregiver tonight. It's up to you guys. Cookie,
this-
how are you?
This one is quick.
We might have to take an intermission because I've been drinking beer.
Okay, this one's Chris.
Well, that's funny because Robbie made this comment.
What did he say?
Stella Artois is going to bend. Yeah, right.
No, I'm going to get them to sponsor us, Robbie. MF. I will. We were just talking about it. Like, don't let conspiracy theories mess with you.
So,
are you really?
it's this guy. It's the guy. He's actually kind of hosting this book club, but I just wanted to get a flavor of this guy so I could
Who is it?
talk crap about him.
Are you going
Hold
to?
on. Yeah.
He's a Hyman.
Let's play the video.
He looks like a doctor.
Significant
He
extent.
looks like
Not
Hyman.
this guy.
Oh, okay.
In terms of whether
Wait,
the
I get the
Congress
wrong
laws
clip?
provides enough basis for a nationwide cap, I'll leave that to
are you
the
doing?
common law.
I have no idea what
Here
you're
we
doing.
go. Hold on.
Dr. Anderson, comment on the federal role. I know it's
This guy in the top right.
it's not the dominant role,
Go
but we
Chris.
do have
Ooh,
100 United
Chris.
States senators who are probably saying there is a big federal role. What do you perceive being right in the middle of these issues for so many
Was the
years?
majority leader?
Yes.
Well, first I would
And
echo
then
all of
this
the
is his buddy.
qualifiers from Professor Hyman in
Dr.
terms of
Evil.
my opinion. But I will say this, I think that medicine has become really a national specialty. I think we see this in the way medicine's practiced. We see it in consolidation that occurs across the country. Most standards of care, although in theory they're set by state, in truth, they look the same across the whole country.
Fucking scumbag.
And medical licensure is state. But the truth is, in the area of telemedicine and movement of the population, it makes sense to have national licensure. For all of those reasons, I think there's an argument to be made for federal caps.
Oh, yeah. We need those. Guys.
Dr. Anderson, the title of the book,
I think that was it. Yeah. So, yeah.
Oh, just so you know, Cookie, your sound is better.
Thanks.
Yep.
So yeah, that first he likes to present himself as a doctor. It is the business of medicine where he's made his fortune. Much of that came from his holdings in Columbia HCA, America's largest private hospital chain, which is founded by his brother and father. Columbia HCA's profit-driven brand of medical care nearly imploded several years ago after federal regulators fined the company $1.7 billion, and the largest such fine in history, after finding the company had committed massive fraud against Medicare. Let's see, Marshall, Great Bend, Kansas. A local prosecutor who was the son of one of Roger Marshall's. Oh, no, sorry, that was the last guy.
Ooh, I mixed it up. I'm
That's
sorry,
all right.
sir.
No, that's all right. That was basically it. Yeah, the guy's a complete D-bag. And because it's all these, every time they get a doctor who's, well, he was majority leader. Yeah, that's why Medicare for All went to Romney Care to the ACA.
Well, that's how they managed to pass it, man, is that Obama was trying to make it seem like, oh, it was a great democratic success, but it was originally, like, I'm sure everyone has heard it like a million times already. It was a It was a Republican plan passed as a Democratic success. The Republican, like you said, it came from, what was the think tank that it came from? Was it American Heritage, or what was it? God. Well, anyways, so they came from them.
Yeah, I think you're right. I think it was Heritage.
So it came from them. Obama took it, said, oh, this is a Democrat idea. We're going to push it. It's a great success. Everyone's going to be insured. Everyone's going to have cheap insurance. You can access insurance. You'll be covered. Yeah, you're covered, people, but you're not covered. They're either going to outprice you or they're not going to cover you at all. And what's worse is you're not going to be able to do anything about it, because if you sue them for malpractice, odds are you're not going to succeed in your lawsuit.
Right. 80%, there's no payouts, but you are covered. You have to be covered by law.
Yeah,
that's the whole thing. I mean, they're forcing us, but it's also saying that we had so many uninsured people that we had to do something to insure
We
us.
still have that
what
same
else? And then now
uninsured
they're forcing
amount.
me to pay
Well,
it.
you know, yeah.
They're taking my. Do
Right.
we? So they're just
Yeah.
getting
It's
dinged
still
on
like
their
11%.
taxes?
Yeah, it's still
Oh,
like
We
11%.
still have
lovely.
25.6
that-
million
Great.
people uninsured.
Yeah, that was to cover the insurance companies, not to cover the people. The
God
insurance,
damn
it's just,
All right.
that's like you have a social
Can I just
security
talk
number.
about how they sterilize Native American women
Yes,
and
good. Your
move
turn.
on?
We're moving. Malpractice bit's over. Let's talk about some
Really exciting
Mandela kind of
stuff.
crap.
I'm joking. Please, no. I don't want to talk about it now. It's too depressing.
No,
It's really sad.
we already talked about Operation Paperclip earlier. Let's see some of the results.
What was paperclip again?
That's World War II when they brought all the doctors and scientists over from Nazi Germany.
Well, no, this is more like, mistreatment from below. Like they took a law that was federally created, but on a state level, like over 32 states, it was called Title X. And, it's controversial because it has to do with like Planned Parenthood and women's rights and abortion and all that. But really, the Catholics said, please don't include abortion. So they don't. No funding goes towards that. But it's supposed to, the goal of it was that it helps women do family planning. Women, let me be specific, Native American Indian Bureau of Affairs and women in poverty that are on Medicaid during the 60s and 70s, HSS, which is the Health and Human Services. What?
Can I say also, I forgot to add that it's the OBGYN, the obstetricians and the gynecologists that get sued for medical malpractice way more than everybody else because
they take their uteruses.
Well, because
without
doctors
permission.
don't know how, because they never did any medical research on women. They still don't know
Right.
how women work.
We're not getting into medical mistreatment of just women in general, like scientific
that was just
studies,
my point. I just wanted
but
to,
more about minority women and women in poverty.
please.
So Title X was created in order to, the goal was to increase for women in poverty, which happens to be minority women too at times, to increase the time between births and to limit the stress financially and emotionally. But what ended up happening was once it trickled down to the states and the funding for it, it ended up resulting, I'm just going to focus on Native American women because there was a lot of information about what happened in the 60s and 70s of sterilization between like prisoners, male prisoners got sterilized, people who were mentally handicapped got sterilized. Oh my gosh, there's so many slides. You're going to show my slides, my sterilization slides of all these people. But I'm just going to...
I thought Title X was that shit that they made the powder puff girls out of.
Is this it? Wait,
Activate.
that's NDAs.
Okay.
We already
So-
talked about NDAs.
No, it's not NDAs. Are you scrolling through and
Which
doing...
one was it?
It's
It
well,
said
this is
Title
the
X.
start. This
Yeah.
is the start. But so that's really sad. That was actually a picture taken of a woman who she was going to have her baby taken away from her because part of it too was like, okay, so you're in poverty, you're a Native American woman. I just want you to empathize for 1 second, and because Mastermind and I had an argument about coercion and were they really coerced? And the definition of it is not just physical, it's mental coercion too. So first off, we're trained and to think that doctors are authority figures, right? And so we're going to, most of us, I'm not saying all of us, but most of us are trained to think that, you know,
See,
you
this
look
is
up
why
to
we had
them.
an argument, because this is how you started it. You
So-
didn't start with the fact that they said they were going to take their kids away and stop feeding. That's
Right.
coercion.
Yes.
If just
Let me-
looking up to a
okay.
doctor is a God figure.
So what
it's not
happened was
coercion.
HSS said, okay, so there was this woman and she had 4 children, and they said you need to get sterilized. You can't, you know, it's just too economically stressful because they were all anemic. They weren't eating the right nutrition, right, and on the reservation. And they said, we're going to put your children in foster care, in white foster care, or you get sterilized and don't have any more babies. And, you know, that stereotype of like, why do they keep having babies and go on welfare and all that stuff that, you know, I'm sure it like started there. It was just horrible, stereotypical bullshit. Anyway, so, oh, and another thing I thought was cool was Nixon started Title X. So is there a theme there? Like he started the EPA. What else did he start? He started Title X. Anyway, so we won't talk about him.
He gave us
The gold standard. He gave us the petrodollar. That's fine.
Yeah.
And then why did he resign? Why? What was Watergate? I think we should just have a
Focus on your point.
whole show.
Well, if you think about it, Watergate was the biggest bullshit. Because
I know.
It
He
was
just did so
it was
much.
Republicans versus the Democrats. It had no bearing on compared to the shit that they do now. It was just inside football that he resigned.
So Nahilo he was talking to me about eugenics and Marxism and all this stuff. And this kind of really just hits that vein when it was like, this is the first woman on here that was sterilized legally in the United States. She was actually mentally handicapped or mentally capable, or whatever you say. But anyway,
Can't use the R
so they made these sterilization laws and they were abused, you know, like it was these racist, like, I don't know what happened, but they just said, you're poor, you don't deserve to have children.
Worthless eaters.
And if,
They're bringing it back.
like, okay.
They've always
But it
had
wasn't
worthless
just the
eaters. They just didn't have a
government,
name
it
for
was the people, the administrators and stuff, like all the stories I was reading about it was all like the fuckers at the desk.
Yeah, the ones that the bean counters that just see people as
The
worthless
people that
eaters.
will retaliate, against you if you complain about them, and then they'll cut your benefits off altogether or whatever. And the NIH, the National Institute of Health, admitted to this. In 1976, government admits to unauthorized sterilization of Indian women. A study by the U.S. General Accounting Office finds, it was 25 to 42%. So basically 1 out of every 4 Native American women were sterilized. It just
And you
grossed
said that
me
happened
out.
in 1976?
Between like 68 and 78. And
Well,
what came out of that? Oh, go ahead, Cookie, please.
Well, that just makes it even worse because they came out saying they do this all the time. Like in about 50 years, they're going to come out in the future and say something like, oh, the quote unquote vaccine, not going to say which one, but that vaccine was actually not an effective vaccine and we lied to you. You know, if that happens 50 years from now, what good is that doing to people now that actually got conned into, taking that vaccine against their better judgment or will? A lot of them did it against their will.
Coerced. It's called coercion.
Yeah.
And Dr. Dogma. And we could have a whole show on that of how to, and that'll come to our solutions part. I know we're at an hour 10, but I just want to say a couple more things. I mean, I have way more examples of like the prisoners, Native Americans, Black people, like all of it.
I'm not in a hurry.
It's so, I know, but I don't want to take it up. If it comes up, we can talk about it. But
you're on a roll.
well, I just want to say with the Native one, it was also really young girls. And I know that when I was younger, I was like, I don't want kids. I'm going to be a career woman. I'm going to be a politician, whatever. And my doctor wouldn't do it. He would not sterilize. He wouldn't tie my tubes. And he's like, you're too young. Well, he convinced me not to. Imagine, being a poor Native woman who your children are going to be taken away because they're anemic. And they're like, if you don't take care of your children's health, we're going to take them away from you, but you don't have enough money to take care of them, to feed them because of the oppression. Anyway, I'm just angry. So then there's that. Oh, vaccination studies. If you look at that stuff, like when I was reading inserts, when I was getting our son vaccinated, because I heard someone talk about vaccines and I don't want to get too much into that, but if you look at it, it's on prisoner. The control groups are so small. I know we argue about COVID. that was the hugest control group we
Ooh,
ever
you said
had.
a no word.
No, you said it. You brought it
I
up.
did
There
not.
were women.
You said
did.
it. No,
You
he brought
said
it up. You said the word.
Oh, I'm sorry. But anyway, so I didn't know. I don't know. But what I'm saying is like,
Well, and that's what, when you get a vaccine, they have a
insert
card
that says the
and you
case
can,
studies
if you look all the
And
way
I
in the
have every
back, they
single
tell you
one.
who they did the studies on.
that they wanted to give my son. Some of them I did, some of them I spaced out. I only do it if it's been on the market for so long. Like I'm more middle of the road when it comes to like vaccinations and questioning who's making it, why are they making it, how long has it been on the market, what are the side effects, who are the case studies done on, and I have a folder this thick of our sons. I was gonna bust it out, but anyway. So you have to inform yourself. You do. You have to make the effort to inform yourself because these guys are going to mess with you when it comes to, they study on prisoners, on like Tuskegee.
Hey, let me ask you a real important question.
Yes, sir.
What are the odds that they're doing this exact same thing in the Middle East somewhere in a country that begins with G, where a bunch of people are getting
polio vaccine?
It's okay. That is a point. They call it, the natives called it modern day genocide. Sterilization and how we get sterilized. Like in all of our episodes, we were talking like food. Those are endocrine disruptors, right? Like we've got soy up the wazoo in every single product.
Well, what
That's
was
a
the one
total
that just came out? Was
a
that
study
musk,
that was yes. There's a
for-
musk, and if you guys have any children, especially young males, they put it in the perfumes. It's a musk, and it lowers their sperm count. It's a scientific study. I could find Jacqueline, I'll get there where I'm starting to put the links in the or what books I read or whatever. But yeah, that was more modern.
Yeah,
But
it just came out a couple of days ago.
Bill Clinton had a good quote. Yeah, someone, I think a couple people left the chat.
Who cares, woman? Tell your story.
Oh, okay. Well, I think please help. I'm just trying to find the quotes on because you're supposed to run the show. Well, you guys run the show with my slides. Now I want to talk about native power.
This one?
The only benefit that came out of, for me, what I saw, that came out of that whole sterilization thing was, mother of Nancy. This one. Okay. I'm not for, but they called it red power and all this stuff. And it created civil disobedience. Okay. They got messed with. I was going to say the F word again. So bad that that's really when AIM started, like the American Indian movement, and being angry at the government and what they were doing to natives and really opening everybody's eyes to, and they in turn helped other minority women and women in poverty say, stop pressuring me into what to do with my uterus. And then we started developing Roe v. Wade and all this stuff. Anyway, that was the positive of it, that it really opened a lot of people's eyes. It was so fucked up that
again,
that it's after a certain time. Didn't you say it was okay?
I know, but you slapped yourself in the face. So I saw that you said
I don't know. There's just so much. It's just, at what point are you so angry that it creates a whole movement?
That's why I said the
of
show was a
civil
bummer. I've
disobedience?
been bummed out all freaking week, and we need happier stories. This sucks.
Well, could we conclude? I don't know. Are we at a conclusion point?
Yeah.
I'm gonna look.
You don't have any more? Yeah, I don't even want to get into Tuskegee. I think everybody
I'm not
knows
gonna.
about
Everybody,
Tuskegee.
well, not everybody. Everybody who's aware of medical
effed up that
mistreatment
was.
of minorities. And just really quick, it was a study. If you hadn't heard of it, it's messed up. You got to look it up. That's what we were talking about at the beginning of the open with Clinton. Just to say, not that we liked him or whatever.
Sorry. We did bad. So sorry.
But they admitted it finally, which is,
if you
the only positive.
If you have a second after this over, go back to the very beginning. Tell me he doesn't look like Biff Tannen from Back to the Future when he's up there. So sorry.
But what good is admitting that they did it if it doesn't amount to anything? Like Masterman saying is, oh, we're so sorry. That's all that happened. Okay, right. Yeah, great. They admitted to it. When are they going to start talking about reparations for Black people because of something like that?
Well,
that's one of many reasons why.
Abby was saying the term red power and Black power, and so I was like, I like the native sign. I thought it was pretty cool. Sorry, you're right, Cookie. Sorry. Let's get into comments. I only have 5-star comments, you guys.
Oh, yeah, well, we can open it up to the fluffles.
don't know.
I don't want to go into any more medical malpractice, and I was going to talk about Tuskegee, but that's such a downer. So
Well, syphilis.
yeah,
So they just said they were going to treat him, and they didn't. A bunch of African American.
I think
Then
they gave some of them
intentionally,
syphilis.
they gave. No, I didn't read that part.
Or they,
But they gave funding to the university to do a blind study, and there's ethics in science, in the medical industry, which is the Hippocratic Oath. Let's get rid of this. There's ethics, in the medical industry for the Hippocratic Oath that you do no harm. And they were harming them by saying, oh, yeah, we're treating you. And there was even a cure already made. And they were lying to them that they were giving it to them. And that's, again, local fuckery, like state level or even county level, okay? Or even just like one-on-one level. It starts from the top down.
Or just like the
medical fuckery.
Just like
everywhere. Everybody.
Planned Parenthood doctor that was using his own samples to get for the fertility
It wasn't
doctor.
Planned Parenthood. It was here. Down.
No, don't. As 30 bastard kids running around. Use
More
his
than
own
that.
sperm and everybody's their own cousin, their own brother, their own sister. Yeah, you
I'm
gotta
my
be
own
really careful
grandpa.
dating now. You need a DNA profile
this
before you go out on Tinder.
Like the British monarchy?
Good. Yeah, right, exactly. Everybody's going to start having no chin and big ears.
No, what's that other
Confusions?
chin? It's a real pointy chin, and it's like a genetic defect.
Habsburg chin?
Yeah,
call
it's
it?
like real pointy.
Yeah. Yeah,
That one's
I don't
gonna
make
be
fun of
reading.
anybody's chin. I live in a glass house. I don't throw stones. So
I feel like I missed a big point that Cookie said because people are responding to it in the audience, and I'm like, what did I miss? Sorry, Cookie. Sometimes when I'm running stuff,
should we come up with a solution? Do you have a solution?
I think in regards me,
I don't know.
Cookie?
You got a solution?
Cookie.
How are we going to fix
I do
this
have
shit?
some solutions. I got a lot, but I think I
Okay,
already
so
said them.
then go. What is your
Me?
solution? Yeah.
It's so messed up because if you're in poverty, it's harder, but just inform yourself, and at least with malpractice, right? Not the insurance part. You need an individual investor to get that, or a really good fucking job, or be a baker at 3 a.m. and join the union.
We never get the public option. That was the whole point of Medicare for All, is to have a public option. Now you can publicly buy private options. There's no state. You can't get U.S.
Right.
government insurance.
I can shop though,
You can't get,
but it's very confusing. But now in the state of Colorado, somehow we have to pay $50 a month extra to hire a broker to find our insurance for us. So that's really fun.
It's all.
But
That's why it's so expensive. It's all middlemen. The whole problem is middlemen.
Dude, not just that. That's a scam too in itself, because all those insurance companies, they give you the illusion that you have options out there and that there's competition, but all of those companies fall under the same umbrella company. They just are managed differently, and it's the greed of the people that want to drive those companies to make the most money.
Especially in rural America, which we didn't touch on, Cookie. You're absolutely right. So we only have, because we're in a rural area, we only have 2 options for insurance agencies, and I can choose like all these options within that, but I can choose 2 companies and that's it.
Yep.
And then all the doctors won't take it, and now I can't even get a freaking mammogram without paying out of pocket. And I gotta go to a fundraiser where it's mammograms and mocktails. Like, what the fuck? Like,
But hey, you're covered. Congratulations.
yeah, because you know why? I pay $40,000. They actually pay out $120,000 because of the greed of the hospitals, the universities, the doctors. Like, it's just everywhere. I mean, I'm very grateful too. Look at our country. Look at our country, you guys. That's part of the solution is gratitude. Yes, it is. It is. I know we're getting screwed with. Yes. Look at compared to other countries. Like he was saying, I wonder if the same thing's happening in Gaza right now. We're out of the 70s, okay? When's the last time we hear malpractice all the time, and we're able to take them to court?
If we're supposed to be so grateful, then why do we have things like medical tourism, where people fly all the way to Singapore, have a procedure, to
get big butts,
way better coverage, fly back and it's still cheaper than it would be to have that same thing done here, or fly, or
Because they
just
don't
drive
have
down to
insurance.
Mexico,
I
go
will
over the border,
humbly
get your
dude,
teeth done.
I will humbly disagree and say that America does not have the best insurance in the world. Bottom line.
I agree.
Yeah.
But we're not the worst.
We're not.
And that's where a solution
just
for me
fair.
to not cry and get depressed is gratitude, and also inform yourself. If you can afford it, always get a second opinion. Know your diseases. Talk to your pharmacist. If you're on multiple medications
Is your insurance
for
company going to cover
malpractice,
your second opinion?
yes, they will. They covered mine anytime, but you have to wait in line and you have to get accepted by that doctor. And you could have an ailment. Like when we had an issue where I got 3 opinions. 3. It took me 6 months because
Well, that's how they do it.
But I had private insurance at this time. I had a corporate job. So I don't know. I've never tried to do it with Affordable Care, get a second opinion, because I only had one option because we're in a rural area and there was no other types of doctors that I needed
Your
in
second
this area.
opinion
So
would be going to
I was
the
stuck with what I
emergency
had.
room and tell them what's going on.
So the solution is just try to educate yourself as much as possible without going to WebMD. That's all. I'm done.
My solution is you got to get the middlemen and the money out. I know everybody complains about the British and the Canadian socialized medicine, but I'm willing to give that a shot because the one we got just sucks. It sucks. And we were going to tell some personal stories about medical malpractice, but I don't even know if I want to get into that now.
No.
No?
No.
No. Okay. Yeah. I'm a little bitter towards them. I don't trust doctors, so I'll just leave it at that.
All right, man. Well, my solution.
Not like we got a lawsuit, just so you know, Cookie. I just walked away. I ain't suing anybody. I ain't got time for that. Who's got time for tort? I don't know. That's it.
So my solution is don't let the insurance companies get away with it. Fight it as much as you possibly can. Raise as much stink as you possibly can. Do whatever you can to get your coverage because they will deny you as much as possible. You have to advocate for yourself because this system is fucked. We cannot save ourselves because anytime we have any sort of movement started in order to fix this situation, there will always be divisive assholes that'll come in and divide any form of motivation that you get. So the best thing we can do momentarily now, this is just as of right now, is raise as much stink as you can. If you're going to the doctor, go to the doctor every chance you can. Even if you have to pay that $10 copay, go do it. Go check yourselves out. Go get your medical coverage.
Yes.
Do whatever you have to and make the system fucking pay for it. Make them pay for it because they will deny you.
Yes.
Well,
and
I remember seeing there was a
and hopefully,
whistleblower.
I'm sorry, dude. Let me interrupt and let me finish that thought. Hopefully, one day we can move to a point where we can make a movement and not have it divided by fucking red versus blue politics and fucking egos.
Oh, now
Hopefully
that's
one
going to
day.
make me cry. Because
Don't cry. We're live. We are live.
To dogma.
That's why you don't get to drink
Dr.
beer.
Dogma.
That's why you don't get to drink beer before the
I
show.
don't care. I can do whatever I want.
Stop it.
I'm going to do whatever I want.
All right.
I was just going to say, I remember seeing a insurance employee whistleblower that would talk about how the first thing they were instructed to do is when they got a claim was to deny it and send it back and make them apply a second time because half the people would just give up and throw their hands up. So that was 100% profit for them, for everybody that just refused to try a second time. So it's all about profit. It has nothing to do with health. Insurance industry has nothing to do with health. They don't.
And
want
with doctors, it's not even greed anymore. It's dogma. Like their ego, the God complex.
The problem
thing,
is
like,
that
some
the
of them.
doctors,
Not all of them. That's what I was going to say too.
Doctors.
Solution is when you go to your doctor and they know everything and they don't question the norm. And I like doctors who say, I don't know, let me look into that. And then they look into
but
it.
the doctors don't work for hospitals. The doctors work for the insurance companies because the insurance companies tell them what procedures they can. Would you let me finish my point?
Sorry.
The doctors work for the insurance companies because the insurance companies tell them the procedures that they can do and what they can bill. So they don't work for the hospitals. And then the hospitals work for big pharma. I'm kidding. Would you let me finish my point?
I was just saying things because it was at Solutions. And he's
So you guys
still
are married,
bitching.
huh?
Just making a point. All right, forget it.
Oh.
Nope, I'm not going to make it now. You can all, everybody
Make the
can blame
people,
Better
make the
Half Hour in the
fluffles
chat.
suffer.
No, they can all blame you in the chat. I won't watch
Cookies
it.
the other day, he said we shouldn't bicker because we take it to bed.
No,
It's not.
no.
We don't.
She just likes to annoy me when I'm live on YouTube, so I can't do anything about it.
Okay.
No, but then the insurance companies, so the doctors work for the insurance companies, and then the hospitals are actually working for big pharma because if a doctor does something like prescribe something that isn't necessarily what's supposed to be used during a certain medical issue, and I'm not going to use any of those words because we all know what I'm talking about, then the hospital will can the doctor because big pharma told them that they can't use something that is what? You don't think that's true? You don't think that there were doctors that got fired a few years ago for,
I'm listening
for
and
giving a Joe
getting
Rogan?
angry at your statement. Move on.
Okay, so my solution, yeah, that was it, is
What?
get the money, get all the middlemen and insurance companies out of there
How?
and just go with socialized medicine.
Ooh.
Who's voting for that? Who's voting for Obamacare?
That's not socialized medicine, that's
Who's voting for
Romney-Care.
Bernie?
I'm talking about Medicare for all. Like your mama has, and like,
Which is shit.
like I'm gonna have very soon.
We're not even talking about all the problems with Medicare.
I know, but you know how much she pays for it every month?
If she gets better supplemental stuff. we're not
Whatever,
gonna
it's
get
still
into
better
that.
than what I'm getting at $300 a month. She's getting way better.
Which is scheduled to go down next year, by the way, if you
Well,
don't
of
know
course-
that. And
of
so
course it
Social
will.
Security.
Of course.
It's gonna go down.
Well, that's what,
Yeah.
and they're raising the time you can retire because they're hoping everybody will die
Where's that
before
fun
they can.
music you were gonna play? For
All
us?
right, we're out of here.
Let's just blew snot out my nose. We gotta
This-
go.
Yeah, this is
good stuff.
Did I have the banner here? I'm run this.
Just
Okay.
kidding, Cookie.
So I tried to find something that
happens?
was going to be on topic.
Oh, there's more
but
people in here now.
This is
I mean, we
this
could-
is
oh no!
what?
Wait, don't play the song.
What?
Let's look at.
God,
some
Yeah, we have to do
comments.
the start comments. See,
Yeah.
you got me all flustered. We didn't
I
even get
know.
to talk to the fluffles.
I don't know, or we could show it during the music, like we talked about. I don't even know if it's going to be relevant. I'll read it. Oh, healthcare should be organic, natural, and free.
Oh yeah.
Thanks.
Oh, that's funny too because I was accidentally watched Trump's. He had a little rally today, first one since, and their new catchphrase is "Make America safe and affordable." They went from safe to effective. They borrowed safe and effective and went to safe and affordable. I thought that was interesting.
We got to know that Robbie says, my examples isn't medical insurance. If I get sick, I die. My example is auto insurance, which increased 55%, and I don't even drive much.
Right.
Let me just make it clear that it's not even just the fucking health insurance industry that's a scam. It's all insurance that's a scam. I'm talking everything that's insurance based, total fucking scam.
Jacqueline says, what happens in the U.S. and Canada after a newborn baby is taken home? Are there healthcare visits? And during this, I can attest to that, if I may, that during the first year of the baby's life, are there healthcare visits that during the first year of the baby's life? Not during the first year at home, but like I had to have an extra procedure done. We get like nursing specialists at the hospital. They sent us home after 3 days, and I had a major procedure. I had a C-section done. I'm just gonna say it, whatever. And but so they had to come back to remove like the staples. But if I had a natural birth, no, they don't come and help us. You could go into your pediatrician and ask for help,
They might throw in a
and you
husband
can
stitch, but
call.
that's about it.
Play the music. I'm done.
No, that's a joke.
We're taking that one.
That's a joke.
Where's Abby? Abby. No.
Oh, you gotta get back up.
Healthcare should be natural. Oh, we already did that. Sorry. I'm
Next
sorry, guys. Always check no organ donor when you get your driver's license.
Oh, yeah.
I'm an organ donor.
I am not for that very reason. I don't want them to look and say, "Oh, he's coding. What should we do?" Well, check his driver's license. Is he an organ donor? They say, "Yeah." Then, I'm not 100% convinced that they're not going to give my organs away and not try and save me. So I'm with you on that 100%, Ron.
But why would they want to save your organs
Because they also have,
and take them?
they also have
Like, what's the motive?
medical tourism, but that goes from a country in the Middle East to the United States, and they get to jump the line for, they don't have to wait.
That was
Hey.
one of your. Oh, I'm sorry, Cookie.
Here's a fun fact about that. Did you know that transplants are not guaranteed to succeed? Even if they do succeed and your body doesn't reject it, it only
Right.
lasts for a certain period of time before
Right.
your body actually does reject it. So it's not even a full cure. Like, let's say you have a fucking kidney or a liver, your body isn't, if it doesn't reject it right away, one day eventually it will, and then you'll end up needing another one. So if you happen to match the person that's really wealthy and can afford to say, hey, that person got in a car accident, I'd like his liver. Well, then if you sit there and flatline, they're not going to resuscitate you. Oops.
Oh, right. Oh, yeah. Well,
Because they need a new one?
they need the liver for somebody
Someone
else.
can afford it. See, you weren't even listening, woman.
I was a little bit. So, but I was trying to find the example of the same thing you were saying. A heart doctor denied a woman a heart transplant. She got a second opinion and didn't die. The doctor who denied the transplant paid out, but did a non-disclosure agreement, like we were saying. He went to a different hospital, and his quote, his latest role. So, okay, just like police or other government people or whatever, public officials can go to another state or wherever if they do something wrong, and they just go to another one. He went to a new hospital, and he made $1 million annually, over $400,000 more than the hospital he was at, where he got the malpractice suit.
Failing upward.
And then he did this video. This was on the C-SPAN website. He did this video, and he was like, "I'm a great doctor." Just like, it was horrible. It was gross. All right, move on to the next comment.
Thank you.
The whole of modern science, modern medical science industry would not be a thing if it wasn't for Henrietta Lacks of unethical doctors at Johns Hopkins University. That was the letter. The students were actually kind of ethical, Rondo. They were the ones who asked the CDC to include medical malpractice on the death certificates. Just so you know.
Right. Well, I think that, once bit, twice shy. Is that it? Was that it for the?
Well, we got 42 new comments since we started that. So give me a second, but we could start music.
Do you want me?
Oh, guys.
Do you want me to run the music while you
Aw,
pop up chats?
people
But then I can't.
Sure.
I can't respond to anybody.
Well, I don't know. Somebody was born early.
Sean, 3 months
read it out loud.
premature. My dad made a joke to his friends that he was going to name me Early Miller. His friend obviously said, "That's a good name, Early Miller. I get it, early." That's a joke. Come on.
Early.
Early. That is funny. Yeah, I think I was right on time, but I was huge. I was
True
like
story.
9 pounds, 12 ounces, something like that. I was big.
I already talked about your big head for Cheryl.
Yeah. Oh, it just knocked my mouth.
Her name's
I
on
know. It's a joke. It was a joke. It's a
We're not going
joke.
to talk about Doxy.
It's a joke.
I'm not seeing play music, baby, and
All right.
I'll do the thanks, guys.
All right. So, like I was
Are you
saying,
okay, Cookie?
you got anything
Yeah,
else?
no,
buddy?
I'm great.
Okay, right on. I tried to find music. Like I said, I didn't want to do bad medicine. So I went off the reservation and found Bill McClintock does these mashups.
Got
There's
Native
a ton
American
of
on the
them.
brain.
You guys should check him out. And this one, if you are a fan of Metallica or
The Pointer
Megadeth
Sisters?
or the Pointer Sisters,
Or both.
you all deserve this. I apologize, but you get what you deserve.
Oh, I
Hey,
like
hold
it.
on. Before you play the
Oh,
video.
Cookie. Yeah.
Yeah.
Yeah. Give me 1 second.
Oh, we got to close. We didn't talk about
yes.
next week's
Oh,
episode.
yeah, duh. Let me just get it.
All right.
get it.
Okay, no, hold on.
Don't do it.
I'm not.
Who's
I'm
closing?
not. I
Is
just
it
pulled
Cookie?
up. Yep.
Okay,
Yes.
I'll scanners. Okay.
Holy
Can I go
cow.
now?
Trying to
Can I
put,
go
yeah, everybody's trying to push me out the door. I'm sticking around, dude.
I'm not pushing you out the door.
Something
That's what I'm saying.
smells
Can I go
funny
now?
and okay. Go ahead.
Can I talk now?
Please.
Sir.
Thank you.
The floor is yours.
Thank you, everyone, for
Go
coming.
ahead.
Please share, like, and subscribe. Oh my God, woman! All right, never mind.
Sorry.
Play the video. We're done.
No, come on, Cookies. You know I'm just.
We're done.
Sometimes-
Play the video.
No, please.
Dude,
please.
play the video or I'm in your stream right now.
Okay.
No.
All right.
Aw.
Please like, share, and subscribe. And we will see you next week on the Tin Rabbit Podcast.
It wasn't me. It was an inside joke.
What?
Every time you ask me a question, you run the blender when I go to answer, and that's what it reminded me of.